What is Queckenstedt sign? We will discuss about Queckenstedt sign. It is a neuroanatomical topic. Queckenstedt sign is a method to diagnose is there is any blockage or any kind of disease or infection of lymphoma or cancer in our subarachnoid space. What is subarachnoid space? We will see. Subarachnoid space is one of the three meningeal layers of our brain and spinal cord around. First one, innermost is pia mater. Second one is the arachnoid matter. Third one is the dura mater. In between the pia and the arachnoid matter, there is subarachnoid cavity, which is extending from our brainstem to hold the spinal cord, and it extends from our brain to sacral to vertebra. In between this, the CSF is floating. CSF is cerebrospinal fluid. Cerebrospinal fluid is a fluid which is carrying our brainstem and spinal cord. Due to this, the weight of our brain is around 1500 to 1400 gram, but due to CSF, we only get 50 gram of our brain. We feel like this. In this CSF is floating from brainstem to subarachnoid space to the spinal cord till end of the sacral to vertebra. In this whole region, its circulation. If there is any blockage, we can find by this Queckenstedt method. First of all, we have to do lumbar puncture. Lumbar puncture is also called spinal tap. Spinal tap is as defined as to taking a method of CSF, cerebrospinal fluid, from our body or spinal cord. We take a sample of spinal cord from in between. We insert needle in L4 and L5 vertebra. Along with needle, when the needle is inserted into subarachnoid space, we attach a manometer with it. Manometer is a pressure measuring device. We measure the pressure of the CSF by attaching the manometer. During this process, lumbar puncture, we do we press the jugular vein of the patient. Here lies the jugular vein beneath this muscle, lower the jaws, and it's not here, it's like this here. There are two pair of jugular veins, internal and external, on both sides of the neck. During the lumbar puncture or spinal tap, we press the jugular vein like this. Patient, we press. When we press the jugular vein, the pressure in the manometer of CSF pressure in the manometer must increase. The pressure reason of this increase is because when we press the jugular vein, the intracranial pressure, means the pressure of CSF in our cranium increases, due to which the whole pressure in the cavity increases. So the CSF pressure in the manometer increases. But when we press the jugular vein during the spinal tap, if the pressure does not increase, it means there is any blockage in the whole cavity, in the spinal cord, in the brainstem, or in brain. In this whole layer, there is some kind of blockage. When we press this jugular vein, the pressure in the manometer does not increase. If the pressure does not increase, it means in the whole passage or pathway, there is any kind of blockage in our subarachnoid space. So it is a method to diagnose any kind of lymphoma, blockage, cancer, any kind of bacterial, viral, pyogenic diseases which are causing any kind of infection in our subarachnoid space, having CSF in it. So basically, it's all about diagnosing our spinal cord if it's having any kind of disease.